Alright, my name is Mia Santiago. Today's date is 03/03/2024. My project will be on congestive heart failure, which is on the left side. There can be two types of heart failure, but the one I'm going to be discussing today is the left side. Alright, so first is, what is it? What's left-sided congestive heart failure? Alright, so it's basically when there's a malfunction in the mitral valve. This means that the left ventricle can no longer pump enough blood around the body, which leads to blood building up in the pulmonary veins. I do have a picture here that just explains right-sided versus left-sided. Left-sided seems to be the most common heart failure. With this, the heart tends to lose the ability to pump enough blood throughout the body, and we're going to get into clinical symptoms as well, and is also caused by coronary artery disease. So symptoms, what can we see with this disease? So some clinical signs, I'm pretty sure we've all seen some of the clinical signs of CHF. What we can see is trouble breathing. That's the main thing. We may need to place the patient in oxygen. Also, CATs, we can actually see pleural effusion. So again, we're going to be seeing the trouble breathing. The patient can actually faint. We're going to see weakness, blue mucous membrane colors, and fatigue. And then on the next, I have the diagnostic test. So for left-sided CHF, it can be diagnosed by auscultation of the heart. We can hear like crackles or fluid. So we can run an X-ray on the patient to see if there's any type of enlargement of the heart. And then we can also see if there's any type of pulmonary edema, which is fluid around the heart. Another test that we can actually run is an ultrasound and a BNP. The one thing I do want to add is that ultrasound tends to be very helpful with this, but unfortunately, if this patient's kind of like too far, they need to be placed in oxygen, and we can actually see an X-ray that shows better. Okay. So some treatment, depending on where the patient's at with this disease, it can be actually fatal. So the treatment of this is placing patients on heart medications. This can actually improve contractility of the heart. It can also treat volume overload and work as a vasodilator, meaning it will allow blood to flow a little bit better. So the first medication we have is enalapril or benazepril. This is a hypertension medication. Sometimes when we have the CHF patients, they tend to have hypertension, but this medication also aids in reducing the pressure, which will allow the heart to pump better. Next one is pimobendan. Another name for this medication is also called vetmedin, but it's a vasodilator and improves contractility and lowers the pressure of the heart. The next one's going to be furosemide, which is a diuretic. What we're going to see sometimes with these medications is, especially furosemide, is increased thirst urination. But what this does is it actually treats the volume overload, but also removes any type of excess fluid around the heart and in the body. So sometimes with CHF patients, we see we see fluid around the heart, or sometimes we see fluid in the lungs. Again, because the heart's not pumping blood, meaning that the fluid kind of stays there. So we need a medication that's going to get that out. And then the last thing is, of course, is to change the diet. If we have a CHF patient, we don't want to keep them on a high sodium diet or a regular adult dog diet. We want them to be low sodium. We also want to reduce both the exercise and stress. So this is just a little bit about the left-sided congestive heart failure. Again, my name is Mia Santiago, and these are my references. Thank you for your time.